to the workshop on integrative spine and movement health. I would like to invite the dignitaries onto the dais. Mr. Mila Jaydev, President FTCCI. Shekhar Agarwal, Convener, Healthcare Committee. Mr. Suresh Kumar Singha, Senior Vice President. Mr. Naresh Kumar Pagadi-Murray, Co-Founder and Director, Ensure Healthy Spine Private Limited. Dr. Suman Tadagonda, Specialist in Spine Movement and Athlete Health, Ensure Healthy Spine Private Limited. So please come on to the dais. I request President Mr. Mila Jaydev to welcome Mr. Naresh and Dr. Suman with a plant. I request Mr. Ravi Kumar, Vice President of FTCCI, to present a plant to Dr. Suman Tadagonda. I now invite Mr. Mila Jaydev, President of FTCCI, to deliver the welcome address.
A very happy good evening to all. My warm welcome to Sri Naresh Kumar Garu, Pagadi-Murray, Co-Founder and Director, Ensure Health Spine Private Limited. Dr. Suman Tadagonda, Specialist in Spine Movement and Athlete Health and Ensure Health Spine Private Limited. My colleagues Suresh Kumar Singhal, Ravi Kumar Garu, Vice President, Shekhar Agarwal, Convener Healthcare FTCCI, and Managing Committee members and past presidents, total FTCCI Secretariat, all the members, welcome for here. For your health purpose, we are conducting a meeting. Because of that, the spine is more important when you are sitting in the chairs and the spine's problem will come. That should not come. Because of that only we requested to doctor give the suggestions. Good evening and welcome to the workshop Integrated Spine and Movement Health. In today's fast-paced world is frequently neglect the core element of our physical health of our spine. The spine not only supports our body but also enables us to move, work and engage in the activities we love. Today, we are here to explore the integrative approach to spine and movement health. This means combining the best traditional medical practices with the complementary therapies, creating a holistic approach that addresses the body, mind, and spirit. Such comprehensive view crucial talking the multi-faced health issues we face today. The workshop brings together to diverse the group experts from doctors and physical therapists to wellness coaches and alternative medicine, and each of you brings unique insights and expertise that the invaluable in our shared mission promote better spine health and overall movement. And Dr. Naresh and Suman Garu, I am confident that your insights will be inspire and educate us all, providing us with all practical tools to improve our health and the health these we serve. Your presence, your today's treatment, to our dedication to better health and better life, the knowledge gain and contractions you may hear will instrumental in our journey toward optimal health. At FTCCI, I firmly believe that healthy community is productive and prosperous community. By supporting initiatives like workshop, we aim to foster culture, health, and wellness that will benefit to individuals, families, and businesses, and the society as a whole. As we embark the today's journey, I encourage you to all engage family, ask questions, share your experience to take full advantage of the wealth of knowledge that surroundings you. Let us work together to build a future where spine is movement, health, and understood, accessible to all. I very much thank you very much for sitting here without spine pain. Thank you.
Thank you, sir, for your warm welcome. Now it's time to delve into the core of our workshop. I invite Mr. Naresh Kumar Pagadimari, co-founder and director of Ensure Healthy Spine Private Limited, to talk about the introduction and need for preventive spine care. So please welcome.
Hello. The whole workshop is to avoid sitting. The second file. Second file on there. Hello. Hello. Yeah. A very good evening, one and all. Andarki namaskaram andi. Thank you very much to Sangeeta madam first. I mean, my first official access into this building was with an introduction from Miss Sandhya from American Chamber of Commerce, Hyderabad chapter. She connected me to Sangeeta madam when she was as a director. I mean, as a growing kid, I know FAPSI, but FTCCI was known to me only last July during the Excellence Awards, because one of our known people's company got an award there. And then I was in that award ceremony and it was very vibrant, and very honestly, madam, that day I thought, okay, I should somewhere get an opportunity to work with FTCCI, because for any problem there is a top to bottom and bottom to top approaches. But I felt spine should always be from top to bottom, because we all go from a head to toe rather than toe to head. So naturally, well, thank you madam, but as an officially, and I'm very thankful, I saw once Shekhar Agarwal sir at AIG and his initiative Vision 2030 Affordable Healthcare for All was also one inspiring from FTCCI. But thank you very much Meela Jayade sir and Suresh sir and Vishala and Ravi Kumar sir for taking time to visit our center, and hopefully you got convinced enough so that you have given us this opportunity this evening to be in, and also all the FTCCI staff members. So before I start, say let's together make the spine and health movement health as a movement for our healthy life and healthy communities, as our president sir has in his welcome remarks. And also we are here, I mean, to start with this workshop, but would also be equally would like to volunteer and support the FTCCI's Vision 2030 Health Care for All, sir. So it's just not the workshop, and also contribute in a small way. We are starting with this workshop. So without taking much time, I wanted to start with a small story. I mean, I'm a biomedical engineer by training, but as an engineer and standing in front of many industrialists who are the backbone of this country. I mean, the industrialists who are visionaries build the country's economy. So we thought, okay, all the backbones of the country should be taken care with the back health. So, and I worked with many good physicians in Hyderabad and in India, but last 3 years back, we started Asian Spine Hospital, which is pioneering spine endoscopic technology for surgery. Okay, one of the biggest myth in the country and in the world is surgery. If you do a spine surgery, many people think you might get paralyzed after the surgery. I mean, there's a truth to it, but it's not 100%, because some cases have happened. And I can tell you one area where technology making a big difference in surgical profession is endoscopic spine surgery, which is make the surgical more safe and effective, and also trying to address that myth. But having said here, I'm not here for surgery, and as such we have not invented the surgery. It's been there for ages. That's one of the solution when needed, and the right solution when it is absolutely needed. But when we started this hospital in 2021, sir, the team which visited, but I wanted to tell this story to President Garu, how this Ensure Healthy Spine has took birth. Actually, in 2 minutes I'll tell. So when we started our July 1st, 2021, we started the outpatient clinic. We thought there is okay, when the people need a surgery, we'll do it endoscopy. Dr. Nageshwar Reddy Garu was our main mentor, who actually named, our company name is Asian Institute of Spine Endoscopy Private Limited. Then he said, no, put for Asian Spine Hospital, it's a common, there's no spine hospital, at least in the state of Telangana. Okay, maybe not much in India as such. Then let all the spine problem people come to you, then you decide who wants what, based on their need, based on the personalized condition. So then we started on July 1st, 2021, we started our OPD, and it was going on. To our surprise, in the first 3 months, we have seen about close to 600 people, which is more than 200. Maybe looks a small number for an hospital, but it was a very big number than what we expected to start with. And then in 6 months, it was more than 1,000, sir. In the 1,000, we, as a hospital, we started with a purpose, but we always wanted to do what is good for the patient, what is need of the patient, serve the need. So as a researcher and as an engineer, after 6 months when I was looking at the data, and we were only few people, like 20 employees organization. So in the lunch meeting, I said, sir, we got about more than 1,000 people to our hospital, and we have done about 100 plus surgeries. What would happen to this close to 90% people? They have come to the hospital with a suffering. It can be mild, moderate to severe, or at the borderline of they may or they may not need surgery. Then he said, most people going out with a prescription of drugs, but everybody saying that you need exercises but not assessed, right? They have identified a problem as a spine surgeon. Then I said, what would happen to them? Then Dr. Sukumar Garu, who is our main surgeon, said, about 30 to 40% of that 90% people would come back, okay, despite they take medicines, because we don't know how they are going to manage or be compliant or be adherence to what they've been told to do. So that actually bothered me. I mean, they're coming here, they've been identified with a problem, and these are all not customers, they're all patients actually. So then I said, sir, why don't we start? And we met with Dr. Subhadra Rani, she's not here, who's our head of yoga and naturopathy. Madam was one of the first one in Hyderabad at Care Hospital, brought yoga into prescription, official yoga for rehabilitation, post-surgery. Then she started doing, and people are feeling better. Some of them we are directing them to this holistic care. We had yoga center and then pain. Then Dr. Suman joined us, who is one of the few sports medicine physicians who understand the movement health as a whole, the musculoskeletal, spine and the muscle. The course that he was trained in Chennai, and then he happened to know to Dr. Sukumar, and we explained this problem. So many problems is increasing trend in the country, especially in the modern world. Then we said we have this vision. Why don't we? He worked as 2 years as a Kerala Blasters football team doctor. So for the athletes who were more prone for injuries, more prone for more pains and all. So he was well versed with high performance, very high activity people. Then he came because of the family reason. He wanted to stay close to his parents. He said, we discussed this idea, we have a plan, let's start informally. So what we did is, all these 80 to 90% people, sir, literally, we started sending as an hospital to other 4th floor, which you have visited, Sureshji. Then they started doing assessment and all. And then close to 1,000 people were assessed. Close to 1,000 people. Suman would probably talk to it in detail. I'm just giving high level. Most of them are in the age group of 25 to 50 years, who are been at the desk jobs, who have been at that. I mean, above 50, we know certain age, natural aging kicks in, and depending on our professions and activities, we have different patterns and habits and different job profiles. But this was very concerning that majority of them can be treatable. Not the need of medicines has gone down. Okay, need of personalized assessment and exercise has shown as the validation. So what we thought is understand the people's feedback, right? We are learning. We have not made any conclusion, no decision. In that process, we understood that more than 95% of the people, right, what was earlier had a prescription of medicines and all, once their pain relief is managed, okay, who are doing at desk jobs, who are doing physically demanding, challenging jobs, hardworking, heavy lifting, these people started feeling better, sir, started feeling better. Yes, the better pain relief and then. But underlying the root, understanding the root cause was always the main goal for us, which Dr. Subhadra and Dr. Suman and his team now started understanding the underlying reasons, and our observations made me to think these people, they have got the integrative approach as find the solution, because not everybody is going to respond to one therapy, it's a combinational. But assessing them personalized, each individual has its own posture, each individual has its own way of handling the movement, which is consciously and unconsciously we don't know. So that led to, okay, when the 1,000 people data, when we analyzed and all, we found we can do bigger impact than the hospital itself. Okay, I mean, when committed to the mission of affordable healthcare for all, the true affordable is not doing surgery for everybody, is not going to make it affordable. The true affordable is, we believe, is prevention. How do we prevent? How do we understand the personalization care? How do we access the care to all so that we prevent by understanding the root cause? That's where we decided in May 2023, we decided after discussing and more than 6 months with Dr. Suman on board, that's what Ensure Healthy Spine was taken birth, sir, and we incorporated. So let's take it a formal route so that we don't want it to, the philosophically Asian Spine Hospital has focused on one thing. Ensure will focus on the bigger mission, which is more primary preventative for spine and movement health. When we do that focus, we learn more and we understand more the problem, and then we are able to identify the potential solutions and able to scale it also. Okay, the approach of scalability to an hospital to an Ensure Spine would be very different. Two things when we said we'll start working with top to bottom approach. So that's when one of our senior friend connected us to AmSham, and exactly it's 11 months today, July 12th, 2023, we did this first workshop, sir. Today is 11 months, so 33 days you can say when we were saving the file. So on July 12th, the AmCham members, like what FTCCI did, their staff and the members, they organized a workshop like this, sir. and that has really given us the takeoff. Okay, it took into the people, mainly the IT professionals. We did this workshop, but in 11 months I can tell you this presentation carries lot of our experiences, lot of our learnings. So it's evolving for the betterment of the people and the society as a whole. So the next slide now. So myself, I'm Naresh, I'm, as I said, biomedical engineer. So that was a story and which was motivated us to get into. Next slide. So what was the purpose? I mean, the why we are here, why we are doing this, very clear. I mean, we all have the good life and all, but for many times we need to be regenerating your spine and our spine and movement health to thrive your active life years and prevent future sufferings. I wanted to say one thing, the spine and the movement is not by disease. Primarily, the cause of the problems, it is more degenerative, it is more how we care ourselves of our own body and the way how we do our movements, more consciously, but we have to be more responsible. Next slide, please. So, we always say it's time to prioritize your spine health in the modern working lives. Why? No, thank you. So, I mean, I'm sure, sir, the industry senior people are sitting here, and the management and the promoters and the working professionals across the world. It used to be the 80%, more than 80% of the people at some point in life, they experience an episode of back pain or a neck pain. Neck pain is a new age, more so in 10 years in India, okay, because of the more screen time, more mobile usage, but the back pain is predominantly been age-old issue, but it's popping up more. And with the generations, now we have 3-4 generations in the society, the pain tolerance has also gone down. So obviously people complaining about back pain has increased. People can. And more than 30 crore of urban Indians experience primarily as a core back pain and neck pain now, sir, which also reflects our data. And then the back pain and neck pain are considered to be one of the main cause of years lived with discomfort. Okay, so that's what disease causes a long-term damage, but the discomfort is this minute, this second, and today. So, which we, in our experience, it says age of 26 to 50 years, and mainly at workplaces. That's why I'm thankful to FTCCI that we got an opportunity to present this in front of the industry senior people, as a lot of industry workplaces under as a members, that this should take. And one of the most common causes which leads to employee sick leave. Okay, they may not say I'm feeling sick, it might be back pain. We don't capture the exact data, mainly in India, but across the world, it is one of the common reasons why people like to go to a physio or a clinic or an hospital and get some pain relief medicines. That's one of the most common. And when we did across the global survey, it's 25% to 50% of sick leave is mainly because of that in an age group of 26 to 50. I mean, above 50, we know we have other diabetes, uncontrolled diabetes, BP and all. And what is all leading to, right? I mean, to your affordable health care for all vision, sir. Why? When we try to take out the unnecessary, unsatisfactory management issues, health management issues, obviously where it is burdens on more MRI scans. I mean, I'm pertaining to the spine, the first thing, X-ray or MRI. So unnecessary imaging. Right? When you don't identify the root cause, when you don't take it personalized, I mean, quoting Suresh sir, when we go to an hospital, we do checkup, we find something else. But finding the right root cause will avoid many of this. In turn, makes it affordable. And then pain medications and surgeries. Right? These are the unnecessary things causing us to have some negative narrative on healthcare as a whole. So obviously, when we put it in a system, it try to address some of those. So I wanted to bring these numbers to your attention, sir, especially Ravi Kumar sir, other day I was explaining you. You see, and all the staff members and all, please, we, in our experience directly, 1820, this is in our last 8 months, sir. Okay, exact individuals, and I've highlighted these numbers. I mean, it is commonly 977 male, 843 female, and distributed average age is 43. So, but predominantly if you see 20 to 50 years, we have more than 50%. I mean, the numbers are talking, right? So that means much younger, yeah. So, and this is our own individual center experience, numbers. Then what are our observations? I mean, Dr. Suman going to dive you in more clinically, but I going to give you high level. Leg limb length. We don't know. There's a difference on our lengths of both our legs that also might be causing, which will wear and tear our footwear. That's one simple observation. And then the flat foot, which is because unless you observe, it is one of the common thing. Pelvic tilt, that means obviously because of the two reasons. What do you mean all these things? Suman will go. Lateral deviation of the spine, and then muscle imbalances. I think I was explaining to past president, sir, the muscle imbalances which tend us to sit on one sided, and sir, and the demographic observation. Why? In whom we are observing, females have more upper back and neck problems, and males have more lower back problems. Desk jobs and physically heavy lifting jobs, people are more vulnerable and risk people. Sleeping position. Okay. I mean, I know, sir, we are sleeping, but sleep is not coming. But the posture is also maybe one reason. So, I mean, this is a small video. I mean, obviously all our team members won't be able to make it this evening, so we took one video. And it's about 2.5 minutes video, sir.
Hi. As a doctor and especially a spine specialist, we see so many patients in our day-to-day practice with spine problems, especially the neck and the lower back problems. When we categorize these patients or these people as three categories, the first category is the patient who is coming with a neck and or a lower back problem, especially the working population, where they often suffer with neck and back problems. So, or the elderly patients where they have a severe neck and back problems, or the children. The second category are the patients who are already underwent some spinal procedure and they are confused what is the post-op management or post-op rehabilitation, how it should be done, until when it should be done. The third set of patients are the important set of population where due to their bad habits or bad working habits, so they might develop grave spine problems or injuries in future. So these are the population we need to educate them and catch them early to prevent spine injuries. We at Ensure Healthy Spine is a unique platform where we can tackle all these set of patients under one roof, where in the form of medical management, physical therapy, yoga therapy, the naturotherapy and sports medicine intervention and the other pain procedures like the form of injections and rarely surgeries. So all these are under one roof where Ensure Healthy Spine helps these set of patients.
Very few we understand that the spine plays a very major role in their physical and mental health. Tracing back to thousands of years of yoga, always yoga has emphasized on the spinal health and how to protect it. And by practicing various dynamic and static postures of yoga, It ensures that intervertebral disc space is maintained, and then alignment of the spine is, and in the sense the curvature is maintained, and also because of the good circulation to the spinal cord through various postures, and it improves the muscular health, strengthens the muscles, and also nerves are better supplied. By doing all this stuff, it ensures that we don't have many diseases which are because of the faulty lifestyle and the stress.
It is of common knowledge that exercise is not only good but very essential for your health. Exercise just doesn't mean hitting the gym and lifting heavy weights and doing a round of cardios. It also encompasses simple basic exercise that are catered to your daily physical requirements. At Ensure Healthy Spine, we are experts in giving exercise prescriptions which can help you gain strength and lead a happy life.
Ensure Healthy Spine. It's time to give your spine the care it needs.
Ensure Healthy Spine. It's time to give your spine the care it needs.
Ensure Healthy Spine. It's time to give your spine the care it needs.
Thank you. I mean, that's what the main team members, I think some of the Dr. Sukumar Gar mains, we started this. So, I prepared this slide mainly as a more of a collaboration with FTCCI. What we are saying, healthy spine and healthy minds. As an industry body, we want the people to be healthy, and because when you have spine problem, obviously your mind will be bothered because of your pain or discomfort. So how we are achieving this healthy spine, healthy minds thing is by personalized spine health functional assessment, and then the posture analysis, the back strengthening programs and corrective and preventive exercise therapy programs, which are actually yielding better outcomes for healthy living, and then also potentially preventing future sufferings. So we thought we get assessed, and then take an action, and then let us be assured of our healthy living. So that's one thing, sir. Then my conclusion slide speaks three things. Friends and colleagues and the industry leaders here, let us care for our spine health. And then we would like to, under Vision 2030, sir, wanted to do a call, a proactive preventive health movement. Okay, in our invitation we said one of the fundamental attitude shift we wanted is shifting from reactive care to proactive preventive care. Let us be proactive. There is I'm quoting, to be careful as a disclaimer, there's a quote, there's a joke, even God says, before seeking moksha, seek your health. So when you want to seek your health, look for your spine health. And it's in BK's Iyengar text also. If you're seeking health, seek for your spine health, because that's what makes our whole structural integrity possible and keep it in turn healthy. So, we say how the Vision 2030 can make it as a movement, which as a healthy life, which we all are seeking, it all starts with a movement. So the movement of our daily activity, and as a movement to revolutionize the shifting of attitude from reactive care, because we all go, when we have a pain, when we are suffering, and a lot of the time we hear, oh sir, you should have come early, you could have done better job in the hospitals. And then as Suman's always says, gym, hitting, cardio, and then hospital. We are saying somewhere in the middle where it's a health. That's why we confine to spine and movement health, which would be the horizontal, sir. Then rest all comes as a vertical pillar. So our proposal and request is, we'd like to, whatever we do, let us take it to at least the working population, sir, in the industry members you have, because they're all breadwinners for their own families, which is male or female in today's world. And also obviously any loss of productivity is a loss to the organization. And there's a clear literature and surveys that people's productivity loss is mainly because of spine health, is one of the, I'm not saying 100%, but it's increasing at an alarming rate. So all the industry leaders, it's part of my introduction, but I want to set the stage and we could discuss more, and also would like to hear from you also how we can together make this happen, and so that at least our 20 years, 30 years will not suffer when they become 40, 50. So we have a next 5 to 10 years to shift the gears towards more proactiveness in our day-to-day life. As I said, the top to bottom, my last statement, the top to bottom is, if it can come like a FTCCI type company, organizations can make it as a policy. In your 9 to 5, sir, we say before 9, everybody, each house is different, each lifestyle is different. After 5, we are all running. But in the 9 to 5, at least if you can able to allocate 10 to 15 minutes of the time, saying that we book all our calendars, everything 9 to 9:30, this, at least allocate the 10 to 15 minutes as a proactive measure, where it for healthy spine and healthy life, healthy minds. I think that will make a big difference as a policy or whatever, sir. I'm open to your at your disposal. But this is all the. Thank you for patiently listening and for this great opportunity. Once Dr. Suman and Dr. Sudha Lakshmi, they walk you through some of action-oriented discussions, we can discuss and make it more interactive, sir. Thank you once again.
Thank you, sir, for an introduction and insightful presentation about healthy spine and its services. Very well explained your views, sir. So, ladies and gentlemen, please give a big round of applause to him. Now we will hear about the importance of proper posture analysis and spine health assessment from Dr. Suman Tadagonda. He is MD in sports medicine and a specialist in spine movement and athlete health at Ensure Healthy Spine Private Limited. So please welcome, sir.
Good evening, everyone. Thank you, President Jaydev sir and Suresh sir and Shekhar sir for inviting us here in the first place, and thank you all the staff of FTCCI who actually spent enough time to have a thought about their health and especially spine health. First of all, I am Dr. Suman. I am a sports medicine physician. I've done my MBBS and then I went on to do my MD in sports medicine. So I specialize with athlete healthcare, and right now I'm working more in a spine segment as well. So I worked with professional athletes. I understand the concept of exercise, but when we talk about exercise in professional level, definitely the intensity of the exercise is going to be very high. So you must be thinking, oh, this guy is coming from athlete population and what is he going to tell us? But exercise is something very unique and individualized to each and everybody. Even in professional sport level also, not everybody can exercise like a Cristiano Ronaldo. Maybe they will exercise in whatever intensity they can. So for them to improve their performance at a certain level, they'll have to increase their intensity of the exercise. Okay, so let's dive into spine health. This unique platform of Ensure Healthy Spine is predominantly for people who are sedentary in life and also who are into exercise also. I just want to have this session is very interactive. So can you all raise your hands who all are exercising regularly? Oh, that's wonderful, sir. Wow, that's good. So whenever I talk or whenever I speak to one of my patients also, I try to understand whether the person is into completely exercise or the other category where people are not yet started their journey in exercise. So every person will have their own journey in exercise. It's not like if somebody is looking fit or somebody is exercising, or maybe if they have gone to the gym for a month or 2 months, doesn't mean they are really fit. So exercise as such is a continuous ongoing process. Even though professional athletes do exercise, they will still undergo injuries. So when we as sedentary people, when we are sitting, it's very common, and I think it's the most common thing that everybody would have experienced some kind of back pain or some kind of neck pain at one point of time, 100%. So what brings us to have a very healthy lifestyle, or how we have to understand, whenever we talk about a spine problem, a neck pain or a back pain, one of the most important things what we have to understand is what is the root cause of this pain, whether it is more of related to our structure or any function particularly which we did. Like a lot of people, when patient comes to me, I'll ask them, did you do something in the last 1 week or 10 days which actually is not of your own routine? Then they will think and say, yes, actually I traveled long, or maybe I've driven too far, or maybe I've lifted something heavy which I'm really not used to. So some kind of physical ailment or some kind of history will be there for them to actually get that. Or the other way is, people have this pain since ages, they would have just left it, and then it would have become a habit for them to live with the pain, and then suddenly it shoots up because again there is some abnormality developed over a period of time. So all these things have to be taken into consideration when we are talking about back pain or neck pain. So first of all, if we see in this fast moving life, everybody is into some kind of other stress. So what we generally tell is, a healthy mind brings a healthy spine, because there are so many nerves coming from the brain, all are going through into the spine and then going to the body. So whatever stresses you carry, everybody will say, yeah, this could be because of the stress, but nobody will say how to get out of that stress. So it's very, very essential for each and every one of us to have a healthy mind, and how to kind of come out of that excessive stress based work life or anything which they have stress in, to come out of that and then lead a healthy life. So healthy mind will definitely have an impact on it, because everything what we do, like the thought we have or the action we do, is only coming from the brain. So it's essential that we have a really healthy mind. For that, what all is essential is your healthy habits. We all want to have a healthy lifestyle, but we don't want to have healthy habits, which is very, very controversial, which is very, very crisscrossed way. To have a healthy body and healthy habits, right from the start of the day to the end of the day, whatever we do, it has to follow in a track that you live a healthy life. Let me break down each and everything now. First thing first, it's my request probably to start exercising in some form, whatever exercise, whether it can be a simple squats, whether it can be a simple, use your stairs in the house and then just go up and down for like good 5-10 minutes, that is also an exercise. So exercise doesn't mean just going to the gym at all. Exercise means simple things which we can do it at home, and try and slightly increasing your heart rate and then relaxing, okay, but making sure there is movement at every end of the body, like whether it is wrist joint or whether it is elbow joint, whether it is shoulder or neck or the back or legs. We have to make sure we are exercising on a regular basis. If not regular basis, in a week, if you take a week into consideration, maybe 2 to 3 days a week to start off is also very, very good. Okay, so along with that, whatever we eat is very essential. So if I ask anybody, okay, can you please give me a little insight on your diet, they'll say, I'll eat very healthy, only very little bit, only at this time, only all these things they'll say. But when it comes to if I ask at what time you have your dinner, they'll say 10:30 in the night. How can that be healthy? it can never be healthy. But I know, I'm sure we all work and go back home late and then eat healthy, but all that change has to happen even in the timing of the diet as well. It's essential. What normal diet we have, like our rice or curries, it comes under macronutrients, the bigger nutrients, but the micronutrients are the vegetables. I keep asking everybody, how many vegetables or how many times you eat vegetables in a day? The answer will be 0. Maybe 8 out of 10 times the answer will be 0. But it's very essential to focus our diet on those micronutrients as well. So you're again coming to the same point, we want a healthy spine, but then we don't want to follow all the healthy habits in a day. But these kind of changes have to happen to have a healthy body and healthy habits. So this is a normal spine curvature. So I'm just trying to show you this curvature because if you can see, there is curve in the level of the lower back and as well as in the upper neck region, which is towards the in this way, okay, like the C shape. So if we don't sit straight or if we don't sit in the right posture, we are going to spoil this curvature. And if this curvature is not the way it should be, that's when we are inviting problems. First and the main reason why anyone gets a spine problem is because the normal curvature is being altered over a period of time. Let it be if we are sitting in the office or if you are sitting in a car or if you are sitting anywhere, if the posture is not right, definitely there will be alterations in the muscle level. Okay. So these are the few facts about the spine health. Again, I think Naresh sir mentioned all these things about the leading disability of in the very active active age work group, and then one of the most common reasons why people take breaks, or 70% of the population have this. If I have to say 70% of the population at some point of time, this is excluding kids. If we ask kids after 10 years, everybody will have this problem because all of them are sitting in front of the screens only. So that is also one main reason why we get these problems. So exercise is definitely helpful, but knowing what exercise to be done or knowing right way to do it is very essential. So I'll just run you through common imbalances. I think you'll be all be much be interested. So if we see our structure from the side, like this side, this hip region is, if it is turned forward or if it is turned backward, these are two major abnormalities we see in our clinic every day. If you see that whole the blue color ring, if it is rotating clockwise, then your pelvis is shifting towards forward, it's going forward, and it is causing too much load on the back. It is creating a lot of tension in the muscles. So the right side picture shows two muscles on the up and then one muscle in the down. So those two muscles, the alteration of their structure will happen, which leads to either spasm in the muscle, which leads to pain, or weakness in the opposite muscle. So main reason, and even if it goes in posterior, the anti-clockwise direction also, too much of rotation can also pain in the other way around. So these are the two main problems: anterior tilt and the posterior tilt of the pelvis. Anterior tilt, as I said, when the hip joint is rotating in clockwise direction, and if it is rotating in anti-clockwise direction, it is the posterior tilt. But the good posture is definitely the third picture, which is straight. Ideally it has to be like that. And one of the main reasons people end up in having back pain or knee pain is also because of their foot position. We generally do a whole spine examination when anybody comes to the clinic, and we observe the position, the way they are walking, the way they are putting their step. When they are putting their step, either their feet is going in direction of the first picture or the last picture, so or it is straight. Very often we see this abnormality. So for this particular thing, we get a foot analysis done to give them proper insole, to get the foot correction done, which will reduce the pain in the knee joint and as well as in the spine. So one of the leading causes for the back pain and the knee pain as well. So this picture should actually tell everything what we do when it comes to spine health, because if we observe this, when we see a patient in the clinic, we see both the shoulders, whether they are in same line or not. Then comes to the rib cage, the spine which is attached to the rib cage, whether it is in straight line or it is in towards one side or rotated towards the other side. So, and then at the level of your hip joint, whether it is towards up or down. Naresh was talking about pelvic tilt and all. So whether it is towards one side, dip towards one side, or lifted towards one more side, we will have to see, because all these things happen because of muscle imbalances. So our job is to identify what muscle is imbalanced and how do we give treatment. So all these things, definitely when you go to the hospital, you immediately people will ask for X-rays and MRIs, but this kind of clinical examination is very important, and to understand what is the root cause of the problem, again coming back to the root cause of problem. So if a lot of people, when I was in a sports team, so in sports in India, I mean in India, anywhere in the world to be frank, when an athlete is getting an opportunity and he's injured, he doesn't want to tell that I'm injured, okay, because he might lose his chance. But we had to make them understand that, are you ready to lose the next 6 months, or will you lose only 2 weeks and then go back to play after 2 weeks? So the question is whether you're trying to prevent.
6 months, 6 years.
Can be, sir, maybe 6 months or 1 year if they're a professional sport. So if they have all the support to do all the rehab and all that. So the question is always to make them understand it's okay to lose 1 week or 2 weeks of game, slow down, take care of yourself, and then go back and play again. A lot of people get injured like that. Now the same thing, I keep telling this to all the IT professionals also, or people who are sitting in front of the desk and working. If you have this kind of problem, you make sure you address it and you move forward. If you don't address it, the problem is, if you don't address it, you might as well take a medicine and then the pain gets masked and then you will move on. But then the next time the problem comes, it will be irreversible. So even a person sitting in a if somebody has a business, or if they have taken care of the business, I know it's very important to go and attend, to go and check their work life, but taking care of themselves is equally essential, because if they are going to lose that 1 week or 2 weeks, then the injury might actually progress badly and might as well take more time for that to recovery from the surgery. So this is the basic clinical assessment we do at our clinics. This is the way we examine spine, though the person has a normal spine. If we see the X-ray of the spine, it is more observed from the neck to all the way up to the hip. So if you see, there is a clearly tilt in the spine. If you can see that, observe in the second picture, the spine is not straight like this, it is like this. So now at that particular time, we will understand which side muscles are in tightness and which side muscles are in weakness. So to do one side of the muscle, the other muscles will overcompensate and then cause a lot of imbalance. That has to be identified and treated immediately. Now we are actually moving into very tech-free zone. We are trying to get something called a 3D spine analysis, in which the machine will be like that, and the patient has to stand in front of the machine. Then through infrared rays, this is not X-ray, there is no radiation, through infrared rays, the details of the exactly, if you see the level of shoulders, the spine curvature, the pelvis level is measured through infrared rays. We are in the verge of getting it as early as possible to our clinic, which will probably scale up the number of the accuracy and also the volume of the people getting tested. So these are the some.
For the spine or you do for the knees
Sir, so this first we do it for spine, and along with this we are also focusing on a foot analysis. When we do foot analysis, it gives an analysis right from the foot to the knee joint and to the hip joint. So it will help us.
If you see on the first picture, the lady is standing on the plate. That actually captures
plate.
your force plate, your load on your joints. So there are different ways of analysis, right? So this gives you the entire from head to toe, but focused on spine, because if there is any spine curve alteration, it immediately picks it up. And all these analysis you saw, the other two right side images, sir, it's using an infrared camera which picks up a good muscle imbalances. Second is structural. And they're also one of the professor of biomechanics, movement biomechanics, not a structure, movement. When you're walking, how does the biomechanics are altered? Because I visited that company in University of Roma in Italy. So they have put AI now. Because AI takes the normal shoulders and the bony landmarks, right, which is supposed to be human structure. So any variations, it immediately detects also. The reason we are going for that is we wanted to scale this. I mean, we can put it in every, large companies, workplaces also, make it a regular change. And it also allows pre and post also, sir. I mean,
So,
Dr. Suman found it, and we are at the verge of partnering with them. I mean, and also do some little bit of our own Indian research.
So initially when I was trying to show the curvature of the whole spine, whether it is cervical or thoracic or the lumbar, this particular machine actually is identifying the minute details of the curvature also. If there is increase in the thoracic vertebra, or there is decrease in the cervical, all that minute details also it's capturing and giving us a lot of data, which can help a lot of people to prevent many spine related problems. So these are some corrective postures to prevent neck and back pain. I'll just put it up. How often we bend ourselves down directly to pick something. It's very common. We are working, we are writing something, the pen falls down, immediately we do this. But it's definitely not a healthy way to do that. The ideal way to pick it up is use your knees, use your hip joints, bend down properly to pick it up. Like even when we try to, especially young mothers and young fathers, they just do this and pick their kid up like this, and they will have a catch. They come to our clinic. When asked any detailed history, they will say, I was actually trying to pick my baby, and then I had a spasm or I had a disc coming out. So it is ideal to hold like this. Just use your knee joint and hip joint also to do the movement. I'm sure people who exercise will know when they are doing squats or lunges. So that is one thing to do. And then even when sitting also, it's the most common and the most terrorizing not only your staff, sir, everyone staff. If you ask me, most of the IT sector or people who are just sitting in front of the computers and working, how common it is for them to just go and see like this. Absolutely, I can see that, sir. I can see that. And
nobody sits, my dear, like this.
And sir, the reason why they don't sit like this for a too long time is their muscles don't support them to sit like that for a too long time. Because of the muscle weakness also, we'll sit like this for some time and then slowly we'll go into this position. So for that, let's say not all the individuals are of same height. The height difference is too much in our population. So it should suit the chair, should suit the person when they are sitting. If you look at that picture, the person sitting correctly has his hip and knee joint in a straight line, and then the feet, the leg going directly in 90 degrees angle. That has to happen for them to sit upright straight. If that is not happening, or people who are just sitting and putting their legs down like this, all those problems come. Okay. Sleeping position again, very frequently that people just sleep like this, keep a hand under the pillow and then sleep. Next day they come and say, they complain, I have a severe shoulder pain, doctor, what should I do? Again, when I go back and ask, when they are sleeping in a side position, this will be the point of contact in the bed. So the distance between the ear and the shoulder has to be covered with a pillow, sorry. Okay. So ideally your spine should be in a straight line even if you're lying down. So ideally, if we see the position of the shoulder here, sir, shoulder to the neck, that space has to be filled with a pillow which is big enough. People either use a very small pillow, or they don't use a pillow, or they use a very big pillow which can cause spasm, so which can cause pain in the neck muscles. So correct posture is either sleeping straight.
We have been taught that if you don't use pillow, that is the best way.
Sir, that is when you are lying down straight. Okay, that too you can use it. You can roll up a towel, Turkish towel, and put it under your neck. See, I told you neck position is lordosis like this, right? So sitting we make it like this, and then while lying down, the neck is used to be like this. Now again you are doing this. So there should be some support here. If not a pillow, just a support which will make sure there is curvature formed in your neck joint, neck.
But in our
అవును సార్, ఆ దిండు ఉండాలి అన్నప్పుడు కరెక్ట్ సైజ్ పిల్లో ఉండాలి సార్. అంతే, ఆ పిల్లో సైజ్ ఒకటి కరెక్ట్ ఉండాలి. అది ఒక్కొక్క ఇండివిజువల్కి డిఫరెంట్గా ఉంటుంది. అప్పుడే మనకి డిఫరెన్స్ వచ్చేస్తుంది. ఎగ్జాక్ట్లీ. మళ్ళీ సైడ్కి పట్టుకున్నప్పుడు కూడా చాలా చిన్న దిండు పెట్టుకుంటారు, అప్పుడు నెక్ ఇలా అయిపోతుంది ఒక సైడ్లో. దానివల్ల ఇదంతా స్పాజంలోకి వెళ్ళిపోతుంది. అట్లా అదే 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 సో so there are certain patients who have come to our clinic, and then we have identified their deformities and then corrected. I would like to show few of them, sir. I will not take too much of your time, sir, if anybody is getting it. So if you see before picture slow, first picture, if you see, this person is a 17-year-old badminton player, very aggressive badminton player, and whenever any player comes or anybody comes, I take a detailed history. I was asking him how much time you are playing badminton. He is saying I am playing 3 hours in the morning, 3 hours in the evening, 6 hours of game, and then in between he will go to the school or college. And then I was asking him, what is your diet routine? I will ask him what is his sleep routine also. He was telling me he will sleep at 12 o'clock in the night. I asked him, give me a phone once. He gave me. Poor guy didn't know what I am going to do. I asked him to open screen time. His screen time was around 6 hours. I asked him, see, you are playing 6 hours, you are going to college maybe 5 hours in between, and then your screen time is 6 hours. Where is your rest? How will your body recover? How will your mind recover from the whole sport? Because of which there was too much of over usage of one side of the shoulder, and his shoulder is like this. When he came to me, he was like this. So within 4 weeks we had corrected his spine, and enkala, what those bones are called as scapula, these bones are called scapula bones. So that correction we had to do for him. It took some time for him, but he got it corrected, and then now he's playing.
Badminton,
yes, sir.
Badminton is played by one hand only.
Yes.
Right. So maximum right hand.
Right hand, dominant hand. Yes.
Some people play with left hand also. That is a different, but only one hand.
Yes, sir.
Always when they play by one hand, that only one hand will be all right, or some damages may occur
yes.
in the one hand. What about the other hand, which is not there is no movement like your other hand, like right hand? So what will be the difference?
So that's
yes. He is the right person. He plays.
Both hands are used for badminton. The muscles are trained both. Without the left hand, right hand, three muscles.
Sir, आप समझो कि
entire shoulder is used when you are hitting a shuttle.
Exactly.
So both the muscles play.
Sir, आप समझो कि
I
आप
can't keep my hand like
you're playing right handed. Imagine you tie your left hand to the waist with a belt and then play.
You got
You will play? No. So the moment, sir, in fact, the force when you hit doesn't just come from the shoulder. Your trunk rotates, your pelvis rotates, and then you do this. Similar example is in tennis. Imagine tennis serve, the ace serve, which comes at 140 kilometers per hour. It just cannot happen with your shoulder. It has to come all the way through the rotation of the spine, forces from your leg.
total body.
Exactly. So energy, sir. When we are talking about muscle, it is called as kinesiology. Kinesiology is study of movements. The energy flows in a kinetic chain. It will flow in a chain which generates force, and also if not used properly, it can lead to injury. It's like that. So
force comes from the toes.
yeah, all the way from the toes.
You don't put your foot on. यहाँ से toes से strength आता है, which comes from the wrist.
Absolutely, absolutely. Only specific shots will have this wrist movements like this, but then eventually the smash which they do comes from full. Sir, this particular person underwent a spine surgery. When he came to us, if you see in the first picture, his spine is slightly tilted towards one side, which is the left side. The right side is slightly hiked like this, and then we put him on an extension based exercise, just simple extension. He actually if you see the first picture, you will see it is looking normal, but if you see the second picture and then look the first picture, you will understand, oh yeah, actually second picture, like his particular shoulder girdle is much more broader, and then by the time the waistline comes, it is much more narrow. The same thing is not there in the first picture before training. But again, he also took good 4 to 6 weeks time with us. Sir, this particular person actually had this spine curvature, and he had pain. He had come with active pain. He is a software employee and he is living in US. He has come here for only 1 week, and fortunately we could recover him in 1 week. He took 4 days time to see this correction, and he went back happily. We are still in follow up with him once in every 2 weeks. He will do exercise with us online. He is a special condition, sir. He is a rifle shooter. When I asked him, rifle shooter, what is your position? He said this is going to be his position. So his left side shoulder is slightly hiked like this, and he had pain in the neck and as well as in the lower back. So he also took around good 2 weeks for recovery. We had to do a lot of muscle corrections. If there is a spasm, we had to intervene into the muscle, release the muscle, and then put dry needling, and then he recovered. Now he has gone back to his shooting. Shooting as his, he says, it is my profession. I do it regularly. He practices maybe. Sir, this particular person, he came with a limb length discrepancy. What Naresh sir was telling, his position was like this, sir. When he came, like this. And if he has to walk, he has to do this, and then he is walking. So whenever he does this, his spine is going towards one side. So for him, we had to do foot correction first, get his foot to almost near normal. It was not normal, it was slightly still less. Then we had to do his correction of the spine and give him exercise. This person was in extreme pain. He was not able to function at all, but now he is continuing his exercises. He is doing very good for himself. Mr. Ram Kumar also, he is again software professional only. He had a spine surgery. After spine surgery, he didn't do his rehab at all. So when he came to us like this, we did the whole spine X-ray to find out the position like this, towards one side, left side. He took around a weekday's time. Basically he recovered very fast. His name is Siddharth. Again, he is a software employee from USA. He also came with a pain. He was unable to sit at all, and we had to identify this curvature problem. Got it corrected. He is doing good for himself now. So he is one basketball player, sir. He has come very recently to our hospital. First video play chestarandi. So when we asked him to bend forward, so he was not able to bend on his own, and he was having pain, severe shooting pain here in this right side glutes. He was not able to bend at all.
Same put face now side just bend down.
He was in pain. So his spine was going towards one side. Put a second video please. This is exactly after 1 week to 10 days. So first video lo there was no hip joint movement, sir. Movement avatle hip joint, rotation avali kada. That was not there. Now in this thing, he was able to use his hip joint better and then bend his spine forward. Yes, sir. Yes, because he was not doing weight bearing on that side. He was only doing like this. Mottam weight right side lone pedtund. So for him to bring his weight in, we had to add ankle weights and then we had to teach him. But again, he still has some amount of scapula problem undi ippudiki kuda, left side lo. He's undergoing his recovery. He's a basketball player. ఏంటి సార్ అదే మేడం see one thing we definitely will teach the ways how to sit straight. Madam, ఇందాకే చెప్పాను కదా, if somebody has to maintain a posture, sit straight for a long time, their muscle groups have to be active. So first nunchi exercise cheyali, exercise is very important, regularly working out is important, and a reason because that is going to be the answer in the end. So not yeah,
Exercise also you should do with awareness.
absolutely
A
sir.
lot of people say I go for walking every day.
No.
They are damaging their spine. When
Absolutely.
walking you should observe every second your posture and everything. You're doing cardio exercise but you're damaging the body. So you need to.
Sir, walking lo, sir, I would like to say this, sir, because my father is a general medicine doctor, and whenever I used to go to clinics with him, he invariably says, "Meek sugar undi, walking cheskopondi." So it's been there in our books also. Diabetes treatment part lo last lo 30 minutes of walking అని ఉంటుంది, and people just kept telling that. బట్ మరీ స్పోర్ట్స్ సైన్స్లోకి వచ్చి ఇంపార్టెన్స్ ఆఫ్ మజిల్ వచ్చే వరకు ఎవ్రీబడి ఈజ్ వాకింగ్ ఆల్రెడీ. బట్ వాకింగ్ ఈజ్ నాట్ బ్యాడ్ థింగ్ సార్, బట్ వీ షుడ్ నో వెదర్ ఆర్ వి వాకింగ్ ప్రాపర్లీ ఆర్ నాట్, అండ్ వైల్ వాకింగ్ ఆర్ వి స్టెప్పింగ్ కరెక్ట్లీ ఆర్ నాట్. ఇప్పుడు స్టెప్ ఇలా మనం స్ట్రైట్గా పెడితే ఓకే, బట్ ఇన్స్టెడ్ ఆఫ్ ఇట్ మీకు ఒక ఫుడ్ పొజిషన్ చూపించాను చూడండి, ఆ ఫుడ్ పొజిషన్ ఇలా వెళ్తుంది అన్నప్పుడు మాత్రం అది ఎవరైనా చెప్తే వీ హ్యావ్ టు గెట్ ఇట్ కరెక్టెడ్. వాకింగ్ యాజ్ సచ్ ఈజ్ ఓకే డీసెంట్, బట్ వాకింగ్ ఈజ్ నాట్ లైక్ ఎక్సర్సైజ్. చాలామంది చెప్తారు సార్, టు బీ ఫ్రాంక్, ఫస్ట్ థింగ్ దే విల్ సే ఐఎమ్ వాకింగ్ ఎవ్రీ డే. యా, యూ విల్ వాక్, యూ విల్ అబ్సల్యూట్లీ strengthen the muscle and then walk, exactly. So walking కానీ, సైక్లింగ్ కానీ, రన్నింగ్ అయితే లాట్ ఆఫ్ women run on treadmill and they come to us, madam. First question I'll ask, what was your goal? What was the goal for you joining gym and doing treadmill? They will say first thing is weight loss. Most common concern for women in 30 plus age group is they want to lose weight. ఇంకా యంగర్ పీపుల్ కూడా ఎలా చెప్తారంటే, సో ఐఎమ్ ఆల్రెడీ ఎంగేజ్డ్, సో within 2 months I'm getting married. Now my in-laws should not recognize me in 2 months అంటారు. That is their goal అంటారు సార్. So I should run very fast అంటారు. No, that's not the way. It doesn't happen like that. Huh? Walking in the morning, 5 people in Hyderabad. Yeah. And
That is bad.
so madam, see, my whole strategy of exercise is we should learn simple exercise for back, simple exercise for upper back, simple exercise for lower back, and konni very few exercise ante there are a lot of aspects madam. One is strength, one is endurance, one is flexibility, stability, mobility. ఇవన్నీ కూడా చాలా ఇంపార్టెంట్. ఈ ఫ్లెక్సిబిలిటీ, స్టెబిలిటీ, మొబిలిటీ అనేది స్మాల్ ఎక్సర్సైజ్తోని వీ కెన్ టీచ్ అనమాట. సో దోస్ థింగ్స్ హూ ల్యాక్స్ స్పైన్ మొబిలిటీ ఆర్ హూ ల్యాక్స్ స్టెబిలిటీ వెన్ దే ఆర్ వాకింగ్ అంటే వెన్ దే ఆర్ స్టాండింగ్ అంటే ఇలా నిల్చుంటే ఓకే, సింగిల్ లెగ్ మీద నిల్చోమంటే స్టేబుల్ ఉండరు, ఇలా పడిపోతుంటారు అనమాట, బ్యాలెన్స్ ఉండదు. సో ఆల్ దోస్ స్మాల్ థింగ్స్ ఆల్సో ఆర్ పార్ట్ ఆఫ్ ఎక్సర్సైజ్ ఓన్లీ. ఇట్ డజంట్, strength is not the only exercise. All these other things also should be focused and should be taught. ఒకసారి నేర్పిస్తే అది ఏ టైమ్ ఆఫ్ ద డేలో చేయాలి, మార్నింగ్ చేయాలా, ఈవినింగ్ చేయాలా, లాట్ ఆఫ్ క్వశ్చన్స్ కమ్ టు మీ. ఇఫ్ ఐ హ్యావ్ టు ఆన్సర్ దట్ క్వశ్చన్, మేము మార్నింగ్ ఎక్సర్సైజ్ చేయాలా, ఈవినింగ్ చేయాలంటే, ఇఫ్ యు ఆర్ నాట్ ఎక్సర్సైజింగ్, స్టార్ట్ ఎనీ టైమ్. If somebody you are into exercise and then you have to think about lot of things. If you are comfortable doing in the morning, that is very good. But morning levvadaniki avvadu, nidra I cannot get up from the bed in the morning ante, evening also you can do, but make sure it should not be after 7:30 or 8. It has to be before that only. ఎందుకంటే ఎక్సర్సైజ్ చేసినప్పుడు మన బాడీలోని అడ్రినలిన్ రష్ ఎక్కువ ఉంటుంది సార్. దట్ విల్ ప్రాబబ్లీ మన స్లీప్ని ఎఫెక్ట్ చేస్తుంది, కొన్నిసార్లు నిద్రపోనివ్వదు. లాట్ ఆఫ్ ప్రొఫెషనల్ అథ్లీట్స్ హూ ప్లే ఇన్ ద ఈవినింగ్, ఇప్పుడు క్రికెట్ అని వీళ్ళు క్రికెట్ ఆడతారు, ఫుట్బాల్ ఆడతారు, దే విల్ హ్యావ్ స్లీప్లెస్ నైట్ సార్. దే విల్ టేక్ మెడిసిన్ ఫర్ స్లీప్, అంటే సింపుల్ మెలటోనిన్ ఇస్తారు, వాళ్ళు తీసుకుంటారు. బికాజ్ వాళ్ళు పడుకోవాలి, మళ్ళీ నెక్స్ట్ డేకి రికవర్ అవ్వాలి. సో అయితే వాళ్ళు గెలిస్తే అసలు పడుకోలేరు, ఓడిపోతే ఇంకా పడుకోలేరు. సో అట్లనే మనం కూడా ఎక్సర్సైజ్ చేస్తే మేక్ ష్యూర్ వీ డూ ఇట్ ఇన్ అ సర్టన్ టైమ్. అండ్ simple exercise can be taught madam, depending upon one's weaknesses and strengths. We'll figure out an exercise chart for them.
Finish this.
Yeah.
Then madam is asking the practical session.
Okay.
So let us be very focused for the main employees here.
Fine.
What is that
Okay.
exercises?
Sir.
Rather than exercise, as I say.
Sure.
1, 2, 3, 4 checklist for everything.
Okay sir, okay. So what we'll do madam, instead of giving a assessment here, we will give you basic stretches and basic exercise, I think, which everybody can do in sitting position or standing position also. I think that will be better. Okay. Yeah, this is done sir, this is almost over. Yeah, thank you.
Good evening everyone. This is Dr. Lakshmi, BNYS, member of a spine health specialist. For the past 1 year, that is from June 1st, 2023 to till now, we have dealt more than 300 patients, of which spine related or 250 plus. So people after joining at our center, after they started taking treatment, people observe a drastical improvement in their spine health starting from 2 weeks to 3 months. Yoga being an holistic approach, we first look at the root cause of their spinal issues. After that, whether it is related to cervical issues, upper back or lower back issues. And as many of the times, the reason behind their spinal issue is either postural or functional. For example, postural in the sense the way you walk, the way you sit, and the kind of work you did. And at our spine center, we first assess your spine, and also we look at the, as Suman sir said, we look at the at first we look at the structure of their spine, and also arch of their foot, and also at their knees, whether they are in hyperextension or whether they are in hyperflexion, and also mobility of their hip. Because if these lower extremities, if not properly aligned, it will lead to various spine issues. At our center, after assessing the spine, we prepare a plan according to their spine structure by using various type of yoga, like whether it is Iyengar yoga, power yoga, aerial yoga, hatha yoga, or etc. And also we use various therapies like dawn therapy, mudgas, one of the ancient technique which is very beneficial and helpful to strengthen the spinal muscles and also overall the muscles also. And large in stretches, mudgas, pranayams, meditations, and various naturopathy techniques like spinal icing, herbal packs, hip baths, and mud packs and steam bath. All these tools are designed in a way that we design all this in a way that suits to your spine. Like for example, everyone nowadays are so passionate about yoga, and everyone know that if they are having a spinal issue, everyone will do Bhujangasana. But how many of us know that without doing proper corrections, without knowing our spinal structure correctly, if you do Bhujangasana, we are going to damage our spine. See? Sir. Doctor asked me to stop yoga.
Many times a lot of people do this full spine extension when they are not having enough spine mobility also. So we start it very slowly, like start them going on their elbows first, try to activate those muscles, increase the mobility, and then we'll put them into our spine extension. That's a process to go by step by step.
So this is how a Bhujangasana is actually. But you are having any cervical issue, if yoga teacher asks you to do Bhujangasana, if you are having a cervical issue, it puts a lot of pressure on your cervical muscles, which you are further damaging your spine. So at our yoga center, after proper assessment of your spine, we modulate or customize the asana according to your spine structure. For example, this doing resting your elbows and doing like this, the Bhujangasana, will also gives you the same benefit. And if you are having cervical issue, so we'll make you do the same Bhujangasana with cervical, like neck is resting position. And also Pavanamuktasana. సో ఇప్పుడు ఏంటంటే అబ్డోమెన్ లైక్ అబ్డోమెన్ తగ్గాలని చెప్పి వెంటనే పవనముక్తాసన రోల్ చేసేస్తుంటారు. బట్ ఏంటంటే ఇలా పవనముక్తాసన చేయాలి మీకు నెక్ ఇష్యూస్ ఉన్నప్పుడు, హిప్ దగ్గర టైట్నెస్ ఉన్నప్పుడు, లేదా అండ్ నీస్ పెయిన్ఫుల్గా ఉన్నప్పుడు మీరు ఒక పవనముక్తాసన అనేది కంపల్సరీగా చేస్తే ఫర్దర్ మోర్ మీరు మీ స్పైన్ని డ్యామేజ్ చేసుకోగలుగుతున్నారు. అండ్ ఇప్పుడు సేమ్ అదే పవనముక్తాసనాన్ని మనం నెక్ రెస్టింగ్లో పెట్టి అండ్ ఆఫ్టర్ దట్ ఈ విధంగా చేసామంటే ఓన్లీ బై సింగిల్ లెగ్. సో ఇదేంటి మీ స్పైన్ స్ట్రక్చర్కి తగ్గట్టు మీ స్పైన్కి హెల్ప్ఫుల్ అయ్యేలా, యూస్ఫుల్ అయ్యేలా, మీ స్పైనల్ మజిల్స్ రిలాక్స్ అయ్యేలా మనం ఈ ఆసనాన్ని డిజైన్ చేయగలిగాం. సో అప్పుడు ఏంటి దీనివల్ల మీకు ఫర్దర్గా ఏ డ్యామేజ్ జరగకుండా అండ్ ఇట్ విల్ ఆల్సో హెల్ప్ యూ టు రిలాక్స్ యువర్ బ్యాక్ మజిల్స్. అండ్ ఆల్సో ఇప్పుడు మనకు లంబార్ స్టిఫ్నెస్ ఉంది, లోవర్ బ్యాక్ స్టిఫ్నెస్ ఉంది. మీరు ఒక స్పైన్ సెంటర్కి కానీ యోగా సెంటర్కి కానీ వెళ్ళినప్పుడు జస్ట్ ఒక సింపుల్ స్ట్రెచ్ చేసేయండి. లైక్ మీరు వర్కింగ్ అవర్స్లో కూడా చేయొచ్చు. జస్ట్ నించోండి అండ్ ట్విస్ట్ చేయండి, అర్ధకటి చక్రాసన చేసేయండి అని చెప్తారు. బట్ హౌ మెనీ ఆఫ్ అస్ నో దట్ మీకు నీస్ అనేవి హైపర్ ఎక్స్టెన్షన్ ఉండి అండ్ నాక్డ్ నీస్ ఉన్నాయి. అప్పుడు మీరు ఏం చేస్తారు, సరే చెప్పారు కదా అని చెప్పేసి తిప్పేస్తుంటాం అటు సైడ్ ఇటు సైడ్. ఫర్దర్గా మనం ఏం చేస్తున్నాం, నాట్ ఓన్లీ డ్యామేజింగ్ అవర్ స్పైన్, వీఆర్ ఆల్సో డ్యామేజింగ్ అవర్ నీస్. సో మనకు మన స్పైన్ స్ట్రక్చర్ గురించి కరెక్ట్గా తెలిసినట్టయితే దాన్ని మనం ఏ విధంగా కస్టమైజ్ చేసుకోగలము. సో ఇప్పుడు ఏం చేస్తాం, దాన్నే మనము ఒక చైర్లో కూర్చొని స్పైనల్ ట్విస్ట్ చేస్తాం. సో దానివల్ల ఏంటి, మన నీస్ అనేవి రెస్టింగ్లో ఉంటే మనకు కావాల్సిన స్పైన్ బెనిఫిట్ అనేది మనకు వస్తుంది. అండ్ ఇది ఒకటి సో మన డే టు డే యాక్టివిటీస్లో ఒక చిన్న మూమెంట్, ఒక చిన్న వర్క్ చేయాలన్నా మన స్పైన్ హెల్ప్ అనేది మనకు అవసరం. ఈవెన్ ఫర్ లిఫ్టింగ్ అ స్మాల్ పెన్ ఐ నీడ్ అవర్ స్పైన్ సపోర్ట్. అది సపోర్ట్ లేకుండా మనం ఏ చిన్న వర్క్ చేయలేం. అండ్ ఇఫ్ యూ టేక్ స్పైన్ ఇన్ అన్ ఫిజికల్ ఆస్పెక్ట్ పరంగా తీసుకుంటే త్రూ ద స్పైనే మన స్పైనల్ నర్వ్స్ అన్నీ అలైన్ అయి ఉన్నాయి. సో ఆ స్పైనల్ నర్వ్స్ ద్వారానే మనకు ఎనర్జీ అనేది అందుతుంది. ఫర్ ఎగ్జాంపుల్ మీకు ఒక థొరాసిక్ రీజియన్లో డిస్క్ కంప్రెస్ అయి ఉంది. సో ఆ డిస్క్ ఎక్కడైతే కంప్రెస్ అయిందో అక్కడ నుంచి వేరియస్ నర్వ్స్ అనేవి మనకు పాస్ అవుతూ ఉంటాయి. సో ఆ డిస్క్ అనేది కాంప్రెస్ అయినప్పుడు ద నర్వ్ విచ్ ఈజ్ అరైజింగ్ ఫ్రమ్ దేర్ విల్ ఆల్సో గెట్ కంప్రెస్డ్. సో ఆ నర్వ్ ఎక్కడైతే మన ఏ పార్ట్కి ఏ ఆర్గాన్కి అయితే సప్లై చేస్తుందో ఆ ఆర్గాన్ కూడా దెబ్బతింటుంది మనకి. అండ్ ఇఫ్ యూ టేక్ స్పైన్ ఇన్ అన్ స్పిరిచువల్ ఆస్పెక్ట్ లైక్ యోగాలో తీసుకున్నా, మెడిటేషన్లో తీసుకున్నా, మనందరినీ కూర్చునేటప్పుడు స్పైన్ ఎరెక్ట్గా పెట్టి కూర్చోండి. కీప్ యువర్ స్పైన్ స్ట్రైట్ వైల్ సిట్టింగ్, keep your spine straight while doing anything, keep your spine straight. Spine straight in the sense not being like this, allowing our natural curves to rested, shoulder relaxed. It should be like this, it shouldn't be like straight. If we sit like this, we are like furthermore putting pressure on your natural curvature. So our natural curvature ni manam allow chestu, danni rest chestu manam sitting position lo కూర్చోవాలి. And first, doing yogasana is good, but doing yogasana which is needed for your spine is important. And also the second one is application of yoga. So చాలా మంది like per day 30 to 40 minutes yoga చేస్తుంటారు. అండ్ ఫర్ ఎగ్జాంపుల్ వాళ్ళకి ఏదో ఒక వర్క్ వచ్చింది, ఒక 3 to 4 weeks చేయలేదు, అండ్ సడన్లీ దే ఆర్ లిఫ్టింగ్ సమ్ ఆబ్జెక్ట్ అండ్ సడన్లీ దే గెట్ ఎ బ్యాక్ క్యాచ్. సో అప్పుడు ఏంటి, నువ్వు ఆ బ్యాక్ క్యాచ్ వచ్చినప్పుడు అక్కడ ఎటువంటి యోగాసన చేయాలి, ఎటువంటి యోగాసన స్ట్రెచ్ నువ్వు చేస్తే నీ బ్యాక్ మజిల్ రిలీఫ్ అవుతుంది అని తెలియకుండా అవర్స్ టుగెదర్ డైలీ యోగా చేసే ఏంటి ప్రయోజనం మీకు? సో మేము ఇక్కడ ఆ ప్లాన్ని కూడా ప్రొవైడ్ చేస్తామన్నమాట. అండ్ లైక్ ఇప్పుడు వర్క్ చేస్తున్నారు, మీ బిజీ షెడ్యూల్లో యూ కాంట్ ఏబుల్ టు డూ అవర్స్ టుగెదర్ ఆఫ్ ఆసనాస్ సంథింగ్ లైక్ దట్. సో ఇప్పుడు అలా కూర్చున్నప్పుడే సింపుల్ స్ట్రెచెస్ చేయడం ద్వారా మన స్పైన్ ఫర్దర్గా డ్యామేజ్ అవ్వకుండా మనం ఎంతవరకు ప్రొటెక్ట్ చేసుకోగలము అన్నది ఇంపార్టెంట్. అండ్ ఐ వుడ్ లైక్ టు షేర్ వన్ ఆఫ్ అవర్ కస్టమర్స్ జర్నీ ఇన్ అవర్ స్పైన్ హెల్త్ సెంటర్. సో మా స్పైన్ హెల్త్ సెంటర్కి వచ్చినప్పుడు patient is having severe lower back ache and also disc bulges at various regions of the spine and also multiple lesions and dislocations అనేవి represent అయి ఉన్నాయి. సో ఆఫ్టర్ he started taking treatment. ముందు కూడా ఏంటంటే ఈ యోగా సెంటర్లో ఏంటంటే ఇప్పుడు పర్వతాసన అనేది గుడ్ ఫర్ బ్యాక్ హెల్త్. కానీ ఏంటి, ఒక గ్రూప్ సెషన్లో చేసేటప్పుడు మనము ఎలా కంపేర్ చేసుకుంటామంటే మనతో పాటు, అరే వాళ్ళ కాలు కిందకు అందుతున్నాయి, నాకు అందట్లేదు, వాళ్ళు కాలు టచ్ చేయగలుగుతున్నారు, నేను టచ్ చేయట్లేదు. కానీ వాళ్ళ స్పైన్ స్ట్రక్చర్ డిఫరెంట్, మీ స్పైన్ స్ట్రక్చర్ డిఫరెంట్, మీ నీ స్ట్రక్చర్ డిఫరెంట్. అది తెలుసుకోకుండా ఓన్లీ నాకు కాళ్ళు చేతికి అందాలి అని చెప్పి బెండ్ అయిపోయామనుకో ఏమవుతుంది, మళ్ళీ మనం దానివల్ల డిసడ్వాంటేజే వస్తుంది. సో మనం ఫస్ట్ ఏం తెలుసుకోవాలి, నా హిప్ ఎలా ఉంది, నా మొబిలిటీ ఎలా ఉంది, దానికి నెససరీ స్టెప్ తీసుకున్న తర్వాత మీరు యోగాసన చేశారు అంటే యూ విల్ గెట్ ఎ డబుల్ బెనిఫిట్ ఫర్ షూర్. అండ్ వచ్చినప్పుడు ఇటువంటి ప్రాబ్లమ్స్తో ఉన్నారు, ఫస్ట్ వీ మేక్ హిమ్ అండర్స్టాండ్ హౌ హిస్ స్పైన్ ఈజ్. సో తన స్ట్రక్చర్ ఎలా ఉంది, ఆయన స్పైన్ స్ట్రక్చర్కి తగ్గట్టు వీ డిజైన్ సమ్ ఆసనాస్ బై యూజింగ్ వేరియస్ ప్రాప్స్ అండ్ టెక్నిక్స్. ఆఫ్టర్ within 3 weeks of time he recovered very well. Now he can able to do various asanas. So this is his review. And
Spine. You wrote the review with spine or hand?
with the help of the spine we wrote with it. So spine is axial of our being and foundation from which our body grows and develops. So మన స్పైన్కి అంత ఇంపార్టెన్స్ ఉంది. మనం అన్కాన్షియస్గా తెలియకుండా ఒక చిన్న మిస్టేక్ చేయడం వల్ల అది ఇట్ ఈస్ పుటింగ్ లాట్ ఆఫ్ ప్రెషర్ అండ్ ఇట్ ఈస్ లీడింగ్ టు సర్జరీస్. సో ఇప్పుడు ఫర్ ఎగ్జాంపుల్ మనం ప్రాణాయామ చేస్తున్నాం, అక్కడ ఏం చెప్తారు, స్పైన్ స్ట్రైట్గా పెట్టండి అని చెప్తారు. అండ్ అదే స్పైన్ని మీరు నార్మల్గా కూర్చున్నప్పుడు చక్కగా పెట్టుకునే బ్రీతింగ్స్ తీసుకున్నా యుల్ గెట్ ద బెనిఫిట్స్ లైక్ యు ఆర్ గెటింగ్ బెనిఫిట్స్ ఆఫ్ ద ప్రాణాయామ. అలా కాకుండా మీరు నార్మల్గా మనకు ఆక్సిజన్ అనేది చాలా ఇంపార్టెంట్. బట్ మీరు లైక్ స్టూప్డ్ పోస్చర్లో కూర్చున్నప్పుడు మీ చెస్ట్ మజిల్స్ విల్ గెట్ కంజెస్టెడ్, చెస్ట్ మజిల్స్ అనేవి టైట్ అయిపోతాయి. సో నార్మల్ బ్రీత్ తీసుకుంటున్నా నాట్ 100% బ్రెత్ వీఆర్ టేకింగ్. సో అదే పోస్చర్ని మనం కొంచెం స్పైన్ స్ట్రైట్ డైరెక్ట్గా పెట్టుకుని ఒక 1 బ్రెత్ తీసుకున్న 100% ఆఫ్ ఆక్సిజన్ విల్ గో టు అవర్ లంగ్స్. సో బై డూయింగ్ జస్ట్ అ స్మాల్ కరెక్షన్ will give you a lot of benefit. And hope from now onwards you all take care of your spine and your spine will take care of you. Thank you.
Please.
10 minutes. Our Shekhar Agarwal ji.
Thank you, Dr. Suman and the team for the detailed information about spine postures and health assessment, yoga postures. So now we will see some few exercises.
2 minutes break. 2 minutes means 120 seconds. Okay.
You can come here in the front chairs, please, if you don't mind.
Come in the front.
No, I think on the stage it will be better. They can see. You can also go there.
In the back side, you should be in the front, my dear friend. You are not on your regular tie and all. Why today you are in very normal position? Come in the front and sit here.
Krupa, Vishnu and Nikita, help everybody out, okay? Spread yourselves out, help.
Okay, start.
So, I just want to know one thing. Can you hear me, sir? Can you hear me? Sir, how many of you all here work in front of the computer? Almost all? Okay, fine. Okay. So no, sir, because before giving an exercise, it's a habit for us that to know whom we are giving and what we are going to do. Okay. So if somebody is into the computer sitting for a long time, we ideally start them on first neck-based stretches. So now I'll just show you a few neck stretches. Make sure you sit straight like this and keep one side of the hand. Look straight, sir. Looking straight. Don't bend your neck first only. Keeping your hand here, slowly try to bend towards one side. This will stretch your trapezius muscle here. Can you all repeat, sir? Do the same thing. ఇలా సైడ్లో పెట్టుకోండి సార్, సైడ్లో ఈ చెవుల పైన చేతి పెట్టి జస్ట్ బెండ్ టువర్డ్స్ వన్ సైడ్. ఓకే, either side, sir, either side. Okay. Yeah, repeat it on the other side as well. You also repeat another. This is sideways, sir. You end up stretching your ikkada paina unna trapezius muscle.
How many times?
Sir, hold this position for 10 to 15 seconds. Okay? Don't pull yourself too much. Just pull yourself little bit so that you feel that stretch. Okay? सर ये చేతో ఇక్కడ ఇట్లా పై నుంచి పెట్టుకోవాలి మీరు आप ऐसे लगाना है सर आप इस okay sir next thing is same next stretch కానీ you will rotate the neck towards one side, keep your hand above the head and then pull it down like this ఇలా ముందుకి but side లోకి so that yes madam yeah doing it right.
I'm getting sounds cut. Good no.
Sir, the athlete in you is waking up, sir.
Don't go cut.
Sir, next exercise is after working for about 1 hour or 2 hours, you keep your hands back behind like this. Whoever can do this, do it. Otherwise, I'll tell you other ways. Just keep your hand behind and do this movement. అంటే రెండు స్కాపులని ఇలా దగ్గర తీసుకురండి. So this will activate your this particular muscle in the back. Okay? అయితే మీరు కంటిన్యూస్గా చేయొచ్చు, లేకపోతే you can do repetition like this. ఎంత सर जितना है उतना करो सर. Sir, because if we sit for long time while driving your two-wheeler or four-wheeler or anything, you're sitting in front of computer, you end up sitting like this. So to counter that movement, you bring your spine back and activate the muscles in the back. Okay, that is the best way to do it. So the next exercise is so itla kaal meeda kaal eskondi sir, kaal eskoni back straight ga petti ila munduku vangali, but ila don't bend forward like this. Hip ee back straight undali, straight undi ila chesinappudu ikkadantha stretch avutundi. Okay,
Pull your chin forward.
Yeah, as if you are trying to touch something with your chin ila. Okay,
Push your chin forward.
okay, once get up, sit again. Sir, madam chudandi, he is keeping his leg on the other side, but he is bending forward from this hip. ఈ స్పైన్ అంతా స్ట్రైట్ అయ్యాం చూడండి, అంతే. ఇక్కడ స్ట్రెచ్ అవుతుందా, ఈ హిప్ జాయింట్ స్ట్రెచ్, హిప్ మజిల్ స్ట్రెచ్ అవుతున్నాయా, అది. ఓకే, మళ్ళీ ఓకే సిట్ స్ట్రైట్. Sir, another best thing to have little bit of relaxation in the spine is keep your hand on one side of the left side, left hand. Give me left hand. Hold it like this and rotate your spine towards one side. Yes. Rotate it one side.
You also do.
She is going to help all her colleagues do the same thing. सर अच्छा स्ट्रेच मिलेगा सर आपको, ठीक है बोल के नहीं, ठीक है ऑफ कोर्स 100%, बट जब आप करते हो ना, योर एंटायर मसल्स इन द स्पाइन विल गेट good amount of stretch. So it's a simple stretch, sitting like this, holding your handle and then rotating your spine towards one side. Hold this position for 10 to 15 seconds and repeat it on the other side. Okay, that's nice. And okay. Now don't do this, first listen this. I want you all to listen and understand. So in this position, in this exercise, he is going to put his leg forward straight like this. Okay, now he will try to sit and then stretch his hamstring muscle. Okay, this is a very good stretch if you don't have knee problem. If you have knee problem, don't do this. If you have knee problem, because see, when he is trying to sit, there is some load in this, but this is a very good stretch for this muscle. Okavela, if you are not able to do this, simple thing is stand down put your leg on the stairs and just do this, that's all. Very good stretch. Or now you can try. Stand, put your leg forward like this. Put your leg forward and slightly bend forward like this, sir. Ante. Stretch मिल रहा है यहाँ पे? हाँ. This is hamstring stretch. Or, sir, or one more thing I will tell you. Sir, or one more thing I'll tell you. You can also put leg on something like this. That is also very good stretch. Just put your leg on something like this and do this. It is very, very good stretch. Simple stretch. Sir, knee bend cheyandi. Okay, sir, 1 minute. Imagine you're in this position, you're trying to sit in a chair. Okay? Now what you'll do? You'll bend your knee, right? Ala bend chesi, immediately forward bend cheyandi, sir. You can see your hamstring stretch. Sir, sit like, you all can sit like this. Sir, you all can sit like this. Okay. Hug your knees as much as you can. Hug your knees as much as you can. Sir, वो तो stretch है. अगला exercise है. Just do this movement. That is also good. Good for your hip joint. Sir, जितना आएगा उतना करो ना sir.
Back straight. Don't lean straight. Straight here. Be straight.
So just the movement, sir. That's all.
मुझे कोई यहाँ जाना पड़ेगा सेंटर में, जाना पड़ेगा इसको लाठी मार के बैठा, योगा करने के लिए लाठी मार के बैठता है. Now next.
Yeah, the other leg.
सर गोल है सेंटर को ना आने को.
Sir, everybody has stairs in their house. Okay, so hold something like this. Keep your leg outside and then drop your heel like this. It will stretch your calf. Good stretch again, but take some support and do it. Don't do it just like that.
Otherwise you will fall.
Yes, sir. So take support.
If you fall straight, then you broken.
Sir, if you all can see me. Sir, people sitting in the back. If you can see me. Just like this.
Not on the top step. First step. You don't fall down.
This way. It will stretch your calf. Okay. And
Any stretches for the brain?
Spine is good. Imagination is good. Spinal. Yeah.
sir, the one exercise which I told, illa ever cheyalekopotaro, vallu they can go to the wall, keep hands like this, just do this. नहीं सर, वैसा नहीं, वही बोल रहा हूँ. दीवार के पास जाना है, हाथ लगाओ, बस पीछे करना है. हाँ, ज्यादा आगे नहीं आना है सर, यही से बस इतना ही.
Don't shake your neck. No, you're shaking your neck. Neck is straight. Just the shoulder. Neck straight.
How we can compete? You are a yoga teacher.
It will activate this part, sir, this part of the muscles. Yeah. And sir, lean on the wall. You can do this also. Lean on the wall and do it. Not just like this. Lean on the wall. Because your spine should be stable and do this. Okay. I think this is enough, sir. Within whatever small resources we have.
Thank you, Dr. Suman and the team for detailed information about spine postures and yoga exercises. Ladies and gentlemen, please give a big round of applause to them. Now we will start the open house session. I invite Mr. Shekhar Agarwal, past President, Chair of Healthcare Committee, to chair the open house session.
We'll have a very
Over to you, sir.
quick one. Any of your questions or queries, just you can raise your hands. Otherwise, we had a wonderful session, sir. Naresh sir,
Thank you, sir.
Suman sir, Dr. Suman, we had a wonderful session. The theory and Sudha madam, wonderful session. And practical exercises also, all of us we enjoyed. And looking for advanced session from our seniors sometime later on. Okay. Now, anything you like to ask, or we go ahead? Thank you very much. So,
Please.
okay. So, there one question: what type of mattresses we should use? Should we have the cotton one, cotton mattresses earlier days, or sponge mattress, or anything like?
Sir, ideally, the mattress should be firm. It should not be like the one which is there in 5-star hotels, where it is too soft. When you sleep, your spine position goes, instead of it being like this, it will go down like this, which will cause a problem. I get to hear a lot of people complaining after a travel, they'll get this pain. So ideal thing is the mattress which has got foam inside it, which is very firm, not soft. And definitely spring should be avoided. A lot of people have spring mattress as well. Please avoid spring mattresses. Use something which has foam. Okay?
High density foam?
Yeah, high density foam. Even when we were young, that cotton mattress which is stitched properly, tight one is good. But then it slowly goes in like this. It is ideal to flip the mattress or change the head end to leg end and leg end to head end once in every 3 months. I think that will do.
One question, sir. Since this was back of my mind, since we are at FTCCI, if there are any mattresses manufacturer in Telangana, we would like to work and create more awareness, sir, because sleep and sleep positioning is becoming a bigger problem now. Because we have got altered so much.
Century mattresses.
Yeah. Because we are partnering with one organization in Australia where they are working with mattress companies, sir. Because we are looking at root causes. We are not looking at treatments. Suresh ji, Nana, treatments ke liye nahi hai. How we can fix it, which we by default we do it.
Shivroomka ji.
How long it takes for assessment at your facility?
Sir, half an hour, sir. Half an hour. Half an hour to 40 minutes.
You screen entire body?
Yes. Full. From head to the toe. Yes, sir.
Ankit, you want to?
Yes, sir. I have a couple of basic questions, sir. Like those who have sciatica problem, people often they do get, say, advice that you should go for operation. But some of them, most of them, they go for Kerala massage therapy. How effective that is? That is my first question.
Sir, basically, first, any spine problem, I'll tell you the truth. I mean, I think Naresh sir also mentioned that in the beginning. Out of 10 patients, 8 of them can be treated without any surgery. The last 2 or the 3 patients will go for surgery. It's a norm. Okay? And when you're coming to your question, sciatica, it depends on how the patient presents to us. Somebody will say, I have only pain in the back. Somebody will say pain is there throughout all the legs. So when there is pain in the legs, it means the disc is come out and it is compressing the nerve. At that time, we end up seeing the MRI and see how much, we call it as stenosis, how much it is there. If it is minimal and if it is at the initial stage, we probably advise them first initially rest and take medication so that the pain comes down. Once the pain comes down, what should be done so that the nerve compression doesn't happen, and if there is any muscle spasm, we give exercise for the muscle also. In the first place, why does that disc come out is because I told you again, the sitting position, if it is like this, then the vertebra gets opened up like this, so disc comes out. So we end up giving you exercises in which the vertebra gets closed like this. Closed in the sense doesn't close, but will not allow the disc to come out further, like that. And exercises will be prescribed for. Sir, sorry, sir.
Can we cure sciatica pain?
Absolutely, yes, sir. Again, depends, sir. If the compression is too much that it is causing extreme level of pain, immediately we'll say no, this stenosis is too much. It is closing that space through which the nerve has to pass. If that space is completely closed like this, then the surgery is a option. But if the space is this much and the nerve is freely moving, there is some amount of compression that can be cured, sir, not a problem.
This is second.
Sir, what was weeks in addition to that?
Sorry, sir.
Varicose.
That's a different problem.
Varicose. Sir, varicose is completely different. Varicose is usually what happens is your blood vessels, which are veins. What happens in general, normally what happens, that pure blood from the heart goes into the limbs, and then impure blood comes back into the heart, goes to the lung, and then gets corrected, and again flow happens like that. So because of weak leg muscles or weak leg muscles activity, what happens, people who stand for a long time, that return flow, which is called as venous return, does not happen. Okay, and then the blood kind of gets the lymph, basically it kind of gets accumulated in the lower side only. That's when the vein slowly starts bulging it up. Yeah, that is called varicose. But varicose doesn't cause any pain as such, sir. Very rarely it causes pain.
The second point was,
Just to add to your question, see, I always use this common analogy. When there is stone fallen on your leg, okay? Sciatica is a nerve, the name of the nerve. Okay, when the disc comes out, the disc is sitting on the nerve. It's like a stone falling on your leg. Would you remove the stone, or would you see that the stone will melt? So removing the stone is a surgery. If the stone size is smaller, right, you'll allow it to slowly dissolve. It's not hard. So any foreign material that comes and touches your nerve, because nerves are the one which directly connected to your brain. So it decides your intensity of the pain. So yeah, and it also decides your pain tolerance. Okay? At least 20 years back, our generation, they had maximum pain tolerance. Okay, that's why they used to sleep on a flat bed. They get a massage. See, the massage is you're rubbing, so that some of the pain signals are getting numbed to the brain, so that you're not feeling pain. But actually, your underlying cause remains like that. Okay?
to say that the naturopathy doesn't give that much, say, the final solution for your problem.
There are people who says that the disc came out. Okay, they have been doing pain relief. Okay, if you tolerate the pain enough and survive, the body itself do the course correction. So that's why I said, वो मेरे को सर्जरी बोले थे, मगर मैं सर्जरी का करना मन था, but 6 महीने वो पेन कोई भी नहीं बोलते बाहर. But some people says that very clearly, borderline. Okay, the stone is small, so the decision of the person is very important. Yeah, absolutely it works, depending on which stone is on your. If it's smaller, it works.
So one more thing, sir. Sciatic nerve, it has got its own course. So when we are sitting and there is one muscle under the muscle which this nerve goes, that's called piriformis muscle. If that muscle is also very tight and it is compressing the nerve, it gives a similar symptoms like sciatica. So when people come to us, we'll also check that particular muscle. What you're talking about massage is, ऊपर से जो massage करते हैं ना, that I don't know that how much relief people get, but if you are pointing your trigger release to particular muscle, then probably you can get that relief what you're talking about. But as such, general massage will not cause any relief and all that. But if you are focused on that particular muscle and release that muscle, that's why I was telling you, we do manual release and we also do dry needling. Dry needling is directly going into the muscle and puncturing the trigger which is there. Then person will feel a lot of relief.
So some of the RO or say water purification companies, specifically Japanese company, they promise that if you consume that kind of alkaline water, it gives you relief whenever you have problem with sciatica or similar things. So does it have any catalytic, ions working and relaxing your muscle or nerves? Is there any scientific say evidences of
I
doing
don't
it? Because
think
they all get sailed
I
out.
don't-
You are talking of Kenyan water, it doesn't work.
No, sir, it doesn't. I mean, to be frank, if you are having healthy water, I think it is good for your body. But I mean, it will keep your body hydrated. But no, nothing like that. That material will not cause anything. No, nothing like that. No, sir,
Thank
it
you,
doesn't
sir.
help, sir. Ma'am, that's a good question, madam. Actually, just now, till now, we were trying to show a lot of stretches. So, ideally, these stretches, you can do it in 5 to 7 minutes. So, if you have a break after 2 hours, once in every 2 hours, if you have real stiffness and you are struggling, probably do it once in every 2 hours. Or else, you can do it once in the morning, once in the evening. That is also fine. Depending upon your if you have a lot of stiffness, if you feel very tight and you want to feel stretching for a little bit more time, you can do it once in every 2 hours also. Nothing wrong, no wrong in that. But as such, as a habit, you can do it maybe once in the morning, once in the evening. That's fine. Sir.
Regarding pillow, you like to tell what are we?
Sir, I was telling about the pillow while I was talking also. Pillows sometimes put a lot of people put bigger pillows.
Sir, pillow, suniye. Yeah, please. Please go ahead.
Yeah. So if you put a bigger pillow, then you end up sleeping like this, which will cause too much load on your neck muscles. If you are sleeping in the sideways position, your point of collision in the bed is your shoulder. So the distance between the shoulder till the ear has to be covered with the pillow. So if you are sleeping sideways, you can use a slightly bigger pillow because this space is much bigger. If you are lying down straight, probably a smaller pillow will also do.
Okay. Anything else, doctor, you like to add? Thank you very much. Over to Vishala.
See, all this, our Sangeeta was asking when should we do this stretching exercises. Whenever you do your stretching exercises, do it once an hour or once in half an hour or 2 hours. But be in awareness, observe your breath and do. Just don't start stretching like that. You'll get catches. It is dangerous. So what you do is be in awareness and do. Very important. People will...
For entertaining awareness is very, very important.
Vishala.
Thank you, everyone. I now request our President, Mr. Mila Jaydev, to present a memento to Dr. Naresh. And I request Vice President, Mr. Ravi Kumar sir, to present a memento to Dr. Suman. All are requested to please come on to the dais for a group picture. I request Mr. Suresh Kumar Singha, Senior Vice President of FTCCI, to propose a vote of thanks. Please.
Don't worry. I know you. Good evening to all. It's my privilege to present a vote of thanks on behalf of Federation of Telangana Chamber of Commerce and Industry to Mr. Naresh Kumarji, co-founder and director, Ensure Healthy Spine Private Limited, and Dr. Sumanji, MD, Sports Medicines, specialist in spine movements and athletes health, Ensure Healthy Spine Private Limited. Exercise for healthy spine, healthy workplace. Sir, thank you very much for your sparing so much valuable time, and you are running a hospital, and even after that You have spared almost 2.5 hours now with us, and your insights and deliberations are very good on the health, and our people definitely will be benefited out of it. Thank you very much, sir. And I thank our Shekhar Agarwal ji, the curator of this event.
Sangeeta madam.
Sangeeta madam, yes, our president who has spared totally 2.5 hours today. I am saying after a long time he has spared so much time because he is always busy.
Next he'll be sitting.
Always he is too busy. Definitely one should be busy always. But today he has spared his valuable time. Thank you very much, sir. Thank you very much all the participants and past presidents, MC members, advisors. Our Raju Sahab he is there from the beginning and up to the last. And thank you very much, Ravi Kumar ji. And he is also, he is a yoga, teacher, I can say.
National badminton
yes,
player.
national president. Yes, something. He is having all the feathers in his cap. So salute to you, sir. Thank you very much. So thank you everyone for sparing their valuable time and hearing patiently and listening what yoga is, what is actually spine, and backbone we talk. Backbone is for everything. Backbone we call economy of the country is backbone of the country. Like our backbone is bust. It should be in a fit condition every time, all the time, because if anything goes wrong with the spine, then you are bedridden. I have seen many people who are bedridden because of spine. And I think every person, or you can say out of 100, 50 people will say I am having back pain. So you have to keep your spine always in a fit condition, and whatever our Naresh have told you or our Sumanji, so you have to follow their guidelines for keeping your spine fit. And I request our Naresh and Sumanji, please follow, because I even when I have visited your facilities, your hospital, I have seen you are doing a wonderful job. But at the same time, I am requesting you to follow ethics and build trust among the patients who are visiting your hospital, because we had just 2 days or 3 days back, we had one session, our Shekhar Agarwal ji has, because it was a global one, and we were talking about ethics, trust, and everything in medical arena, because hospitals, many hospitals are not following ethics, many doctors are not following ethics, and sometimes the health of a patient is spoiled. And we are talking about quality and affordable health. Quality and affordable health is also important. Everybody cannot spare, like Ravi Kumar ji or our president, or I can say myself, who can spend lot of money on health. Or no, I know your things. I know you don't talk. And so many people are there who are not able to afford. So please take care of that also. I request. Thank you very much, sir. Thank you very much.
Thank you, sir. Thank you, everyone. All are requested to please join at the high tea. Thank you, sir.
Photograph. Please come on the stage.
Sir,
for
please
group
come
photo.
on to the stage for your group photograph.
Raju Sahab, Shivji was telling that all committees, they are backbone of federation. So backbone is so important. First. Spine of the federation. And also, when Naresh is telling, we should request our secretary to all our members to spend 10 minutes a day on their spine.
I will make them. Don't worry.
Right.
You allow them. Okay.